So we are going into treatment outline. Adhesive capsulitis, the most common shoulder joint conditions. First line treatment is physiotherapy with paracetamol. Second line, you can add NSAID like ibuprofen, naproxen, etc. unless they are contraindicated. Third line is oral glucocorticoids. Do not use if poorly controlled diabetes mellitus. Starting with 40 mg per day, tapered within 2 to 6 weeks. Or we can consider injection triamcinolone 20 mg as intra-articular or subacromial injections. It provides rapid relief which will last for 6 weeks. Next options are ESWT, which is extracorporeal shock wave therapy, surgical therapy, manipulation under anesthesia, hydrodilatation, and arthroscopic capsular release. Now we are going to know the treatment outline of acrominoclavicular joint disruption or dislocation. For type 1 and type 2 injuries, conservative management. NSAIDs are the first line. Typically used ibuprofen, naproxen, indomethacin, diclofenac, sulindac, etc. But if documented hypersensitivity to aspirin or NSAIDs, or upper GI disease, or taking anticoagulants, we should go for alternative second line. For mild to moderate pain, give acetaminophen with codeine. For moderate to severe pain, give acetaminophen with hydrocodone bitartrate. For type 3 injuries, surgery is preferred than conservative, and type 4 to 6, surgery is needed as a must. Surgery which is done here is open reduction and stabilization of the shoulder. Next, we are going to know the treatment outline of brachial neuritis. First, physical therapy. Maintain full range of motion with active and passive movement. Give symptomatic treatment, that is paracetamol or other opiate analgesics. Steroids, IVIG, etc. are not proven to be useful. If it does not achieve good recovery over 2 years, surgical intervention is needed. Now, what is the acute phase treatment of rotator cuff tear? Is the rest with ice pack 20 minutes as 3 to 4 times per day with paracetamol or NSAIDs. Later, recovery phase and maintenance phase will be managed by surgical and rehabilitation team. Now, let's know the treatment outline of supraspinatus tendonitis. In acute phase, we give physical therapy, NSAIDs. In recovery phase, give rehabilitation with physical therapy, subacromial injection of platelet-rich plasma, shortly PRP. In the maintenance phase, again physical therapy with rehabilitation. If patient does not improve after 3 to 6 months of conservative management, go for surgery with surgical referral. Now the treatment outline of shoulder subluxation in acute phase. Immobilize the arm in a sling for 1 to 3 weeks with rest. If recurrent shoulder subluxation or dislocation, consider surgery. In recovery and maintenance phase, give rehabilitation with physical therapy. and we can also give surgical therapy if needed. Now, heel chassis lesions. If there is a small lesion affecting less than 20% of humeral head actually, keep physical therapy and careful observation. If large lesion affecting more than 20% of the humeral head, then we need surgery, so give surgical treatment. Now the treatment outline of glenohumeral joint osteoarthritis, also called shoulder osteoarthritis, so treatment is similar to osteoarthritis. First line paracetamol. If insufficient, add opiate analgesics. Next, in second line, add or substitute with NSAIDs or COX-2 inhibitors. Remember to start with lowest effective dose of NSAIDs and combine them with a proton pump inhibitor. If still pain is not controlled for moderate to severe pain, we can give intra-articular steroid injection. And in advanced stage, if above all fails, joint replacement.